Hi, I'm Dr. Christine Anderson, and I am a pediatric chiropractor who has been practicing in Los Angeles for over 30 years. And I also have a subspecialty in childhood developmental disorders. And so I am going to talk about developmental milestones on my show tonight. So, I've gone through a lot of different aspects lately about childhood development, including primitive reflexes, and it sort of ties into what we see with milestone development. So let's dive right on in. So, what are developmental milestones? Well, these are the things we see in babies as they are growing and developing, and their nervous system is maturing. So these are things that are windows into the brain development and the nervous system development that we can see, and they should be happening at a predictable time in their development, especially in that first year of life. There's a lot going on with the development of the brain and their spine and their body. But continuing on in childhood, especially until the school age, and it's going to be a sequential fashion. So it's not an arbitrary thing. It's not, oh, your baby will walk when they're ready to walk, or they'll talk when they're ready to talk. These things are supposed to happen in a predictable fashion because the brain development occurs in a sequential fashion. So when milestones are missed or delayed, this is a red flag. And you should not take a wait and see approach. You should be proactive about figuring out why your child is skipping a milestone or a milestone is delayed. And if you get onto it right away, that is the best thing that you can do, so that otherwise they tend to sort of build up on you. So if your child is delayed rolling over, then sitting up is delayed, then crawling, and that sort of thing. So as soon as you see there might be something going on with delaying of milestones, get on it. Of course, being a chiropractor and specializing in neurology, I, of course, would say go to someone who is a specialist in functional neurology, who also sees children, such as myself. All right, so there are different areas of development we see as children are developing, and that includes the sensory aspect, so auditory and visual, so sight and hearing, super important, as well as proprioceptive and touching, but these are going to be more obvious to see if children are responding to when you're talking to them, if they can hear sounds, and of course if they can see. Social emotional, this is really, really important in the first couple of years of life. Sets you up for your whole life. Motor skills, which include gross motor and fine motor. Cognitive, that's what we think of when we think of intelligence. It's the upper aspect, our top-down control of our brain. And then, of course, speech and language, which is language is a very complicated process because it involves many parts of the brain. So let's begin at the beginning with army crawling. And this should occur in the time frame of about 0 to 6 months. So even newborn babies, if you put them on mom's belly, they will do an army crawl up to her breast right after birth. It is so cool to see this. This is another reason why tummy time is so important, because if a baby is not allowed to go on their tummy, then they're not going to be able to do the things that they need to do to army crawl. And this really sets them up again for lifetime as awareness of cause and effect. In other words, I do this with my body, and then this happens. And then mom and dad respond, and it sets up this whole cascade of involvement in not only their physical bodies, but their emotional and social. It helps them to make moral choices and have a capacity for empathy and kindness. And it's going to help them develop a dominant side, which usually occurs around 2 years of age. So this is a really important step in their development. Next would be the social smile, which comes on about 6 to 7 weeks, and then the laugh, which is more around 3.5 months. And in this, with newborns, they will reflexively smile, but with a true smile, you're going to see the whole face involved, as you can see in this baby there. Their eyes are smiling, their whole face, and they're engaging and looking at the person who they're smiling at. Super important for social and emotional development. And if your baby is not doing this social smile and laugh, it could be an early red flag for autism spectrum disorder. Now, babbling should begin about 2 months for vowels. So babies who are basically cooing like ooh, ah, ee. That is the beginning of babbling. And then it will move on at 5 to 7 months with consonants. So ma, 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 ba, 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 da, 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 that type of thing. And this is going to be their start of looking and experiencing this connection with social, emotional, and language as caretakers are going to start responding. So the baby makes a sound, maybe mom or dad mimics it, or makes a certain facial expression and starts engaging with the baby. And of course, that's going to make them want to communicate even more. And again, the first sign of a possible red flag for autism can be this lack of the baby's babbling, and especially if they're not responding to the caregiver. So if this doesn't occur by 12 months, you really want to take this serious, that they should be making some sounds and attempt to communicate. And if that doesn't occur, as I'll talk about with language and talking, the first thing you want to do is make sure babies can hear, because language and sound is often a response to what's going on in the environment. And hearing them make the noises is one of the cues that they know that they're making a sound. And this red flag of autism is also especially pertinent if they are not engaging and having that social interaction, as well as not babbling. All right, head and neck control. This occurs about 3 to 4 months. And so typically if you lay a newborn on their back and you go to lift them up with their arms, they should try to engage their arms, they should try to engage their head, but at first it's going to be very, very, very minimal. But by 4 months, it should be complete where they have full engagement of their head as you lift them up. So tummy time, again, is super important. It is necessary to develop that neck curve because babies are born in a C shape. They develop their neck curve and their low back curve. And tummy time is a big part of that. They're going to strengthen their neck. And if there is this sign of head lag, there may be an issue with a motor delay. And that means the communication between the brain and the muscles that hold up the head, there's some miscommunication there. Now, this can be due to something more serious like cerebral palsy or muscular dystrophy or something like that. But it also might be due to subluxation, which are misalignments that can occur in the spine, including the neck, or some restrictions in the cranial bones. And so this is where chiropractic can help with that communication of the brain and the muscles in the neck so that the baby can hold their head up. And especially if they've had any birth trauma or a difficult birth, but this can happen even in easy natural births too. So check out my video on craniosacral therapy for babies, and I go through a lot of the aspects of why this can help. All right, rolling over, 4 to 6 months. So in order for babies to roll over, guess what? They have to be able to use their bodies. So they need to be doing tummy time, and they need to be on their back, and then they're going to move their bodies in a certain way, and primitive reflexes and postural reflexes are helpful in this manner. And you can check out those. I'll put the links in the description below. But they turn their head, and writing reflexes, the rest of the body turns, and before they know it, they roll over and their brain goes, whoa. So when I do this, this happens, and they can do it repeatedly, especially if they're looking maybe at a toy that's hanging over them or over to the side. I love those gyms that go over them. So they can kick, they can bat, they can turn and look at things. And this is going to facilitate them doing the motions they need to roll over. But if they're not able to move because they're in some sort of contraption, this is what the term I use for car seats and bouncy seats and walkers and jumpers and, wherever they're strapped in that they cannot move to have this milestone met, then it's going to be very difficult. It's also going to help develop their vestibular system. That's the inner ear. So when they roll over, it's going to send signals to the brain. And then also proprioception, which are the receptors in the rest of the body, which basically tell the brain where the body is at all times. Now, if this is delayed, I would also check for structural issues. So maybe it's physically not possible for a baby to turn because they're having issues with their neck or shoulders or hips. So these are things I always check out if a baby is being delayed with their rolling over. And then the primitive reflex, the asymmetric tonic neck reflex, is often retained if there is a delay in rolling over. So I would also check for that. Okay. So object permanence. So this is something that's going to occur around 4 months to a year. And this is the aspect, normally before this, if you go away, a child thinks you're gone forever. The baby goes, I don't know where my mom went, she's gone forever. So this is helping with this object permanence, that even though something goes away, it's still in existence. And this is where games like peekaboo come into play. Or you put the blanket over their head and pull the blanket up and go, boo. And, kids love this. This is, they think it's super funny. As you can see in the picture below, the child's even trying to play peekaboo with their hands. And it's really important for brain development of the frontal lobe. This has to do with personality as well, social skills, reasoning skills, and the cause and effect. When I do this, something else happens. And a child who they found is later diagnosed with autism spectrum disorder, or being on the spectrum, as a toddler, they found that they did not play peekaboo. So again, this could be a red flag that there's something going on in the brain. And I did a whole series on autism. So I will put that playlist in the description so you can check that out if you'd like to see what I had to say about that. Okay. So now we're up to about 7 months. And in this is responding to their own name. So a child, when you say their name, by 7 months, they should know their name and respond in some sort of way. At least look at you, make some indication that they know you said their name. So first of all, if they don't respond to sounds and their name, you want to check their hearing. That's numero uno. There was also a study found that year-old babies who did not respond to their name are more likely to be diagnosed on the spectrum or have other developmental problems at age 2. So this is another red flag to keep in mind, and that was based on a study at the UC David Mind Institute fairly recently. Sitting should occur with support at about 4.5 to 6 months, and then with no support at 7 to 9 months. And this is where babies are starting to develop more core strength. They're starting to develop more of their vestibular and proprioceptive system. And if they are not doing this, if they're not sitting up with support or without support, then I would definitely check to see if their integrity of their pelvis, their hips, their neck, their cranial system, make sure that's all intact, that they're comfortable sitting up. And then I would also, once they're able to sit, look at these parachute postural reflexes, which I talk about in my writing reflex video. And if they are not present, you also want to check for retained primitive reflexes, and that can run the gamut of what's going on there. So it's a little bit crazy. I love when I check parachute reflexes and try to push the baby over, and they look at me like, why are you trying to push me over? But this is to see if they actually are able to hold themselves up, especially once they hit 9 months. They should be able to catch themselves without support. All right, cross crawling on hands and knees and by 6 to 9 months at the very latest. And this is a really important milestone. My daughter and I talked about this on our podcast. I'll put a link into the description as well. And there's a lot of things going on here. There's development of so many systems, the vestibular system, sensory system, spatial skills, the near-far aspect of vision, problem solving, memory, cognition, and coordination, because they've got to move opposite sides of the body in a coordinated fashion to be able to move forward. They've got to defy gravity to get up on their hands and knees. So there's so much going on with crawling that can really set them up for life. Now, I put weird in quote marks because anything that isn't cross-crawling, babies will do workarounds. They may roll across the floor. They may scoot on their butt. They may do a thing where they like drag one leg. I mean, they may do like a bear crawl. So they're up on hands and feet, but not their knees. I mean, they will do the workarounds. And there's also the babies that will just sit there until you pick them up, and they make no attempts whatsoever to move. I've had those come in as well. So, of course, I always want to check and make sure the hips are moving properly, the legs, the pelvis, the shoulders, the arms, all those kinds of physical aspects need to be checked, as well as primitive reflexes. If they're retained, they won't be able to do this cross-crawling pattern, and the craniosacral system, because this is really what can affect so much of what goes on in brain development. If there's an absence of locomotion by 1 year, in other words, they're not moving in any way, shape, or form by 1 year, then you might want to start thinking of cerebral palsy and get that checked out, or other neurologic issues. Cerebral palsy is an issue of the brain not being able to tell the body to move. So sometimes it takes a moment for diagnosis, because babies, when they're first born, really don't move much on their own cognitively. But by about a year, a baby should be making some attempts at locomotion. All right, receptive language should be 8 to 12 months. So this is where your baby, your child, is really going to understand what you're saying and be able to respond. So they're going to know a lot more words than they're able to speak. And so you can say things like, get mommy the ball, and they'll go get it, or throw mommy the ball and they'll throw it. This is where they start associated language with meaning. So language has to go through a few areas in the brain. We've got to hear it, then we have to put some meaning to it, and then as we start speaking, we have to vocalize what we want to say, or for language, for reading, we have to visualize it, and cognition of what it means, and then do something with that information. So once again, this could be a red flag with being on the spectrum for a child, or other developmental issues if they're not understanding and responding to what you say. Then there's clapping, and at 9 months, babies will clap, as you're like, clap, and they don't really know much about what they're doing, but they're getting a reaction from it, and then by 12 months they can actually use it as a means of communication spontaneously. It's helping them with their hand-eye coordination. It's helping them a lot with the timing of the brain. And if they cannot clap by 12 months, it's a red flag. We want to make sure there's nothing going on with the connection, either with the action of clapping, so the brain communication, so that there's nothing going on with the shoulders or hands. So I check the spine, the cranial system, the arms, or is there an intentional imitation problem? So they see you clapping, but they're not able to do that motion in a coordinated fashion. That can be a red flag. Or maybe they have sensory issues, so clapping is too loud and they just don't want to do it. All right, imitating gestures. This is involving what we call mirror neurons. And this should occur by 12 months, where children are deliberately copying physical mannerisms. These mirror neurons are actually present at birth. And what they do is they fire, so neurons are brain cells, they fire when another person does an action and that baby is looking at that action, and that fires those neurons in their brain with that same action of the person that's doing it. So it creates a connection neurologically, and is really what many think is the basis of things like empathy and language and socialization, and also distinguishing themselves from other people. So it really is being part of a community and a network that this is super important, which is why there is a broken mirror hypothesis for autism. Because with autism, there's not just one thing like, oh, this is the cause of. There's many different hypotheses, and I talk about some of these in my autism series that I did. First words. By 12 months, your baby should be saying some words. So if they didn't have any babbling, well, that was already a red flag, but if they're not babbling, they're probably not going to talk. So again, you want to check if there's any hearing issues. Kids who are multilingual might speak a little bit later, but usually they've at least been babbling, and also they will have some words that they're saying. But I tend to see that they take a little bit more time, but we want to see that they're headed in that direction. Also exposure to language. Now, I have 3 children. They're grown now. But when they were babies, what I found myself doing subconsciously, I wasn't going, oh, I've got to say these things, but it was a running commentary of, oh, we're going to go to the grocery store. Okay, we're at the store, and should we have broccoli or cauliflower? And, you're just constantly talking. Okay, we're going to put your shirt on and your pants and your shoes. I found myself having a running commentary about whatever we were doing. And so what that is doing, because most children, if they're not going to maybe a daycare situation or that type of thing, they're home with a caregiver. And if you're not talking, how is that baby supposed to get exposure to language? So I think it's internally, at least I felt it like was internally hardwired into me. But if this is something you don't find yourself doing, I think it's really important to do that so your baby hears language on a regular basis. And I read books to my children from a very young age, even as babies, before they could actually understand. So I feel like this really does make a huge difference. And of course, if there is no speech by 12 months, hopefully I've been seeing them all along, but if they're just getting into my office, I'm going to check for retained primitive reflexes. Walking, 12 to 14 months. Now, we really do want to see a child getting ready to walk. They should have been cruising where they pull themselves up and they start holding on to furniture and couches and walking along before they do it without any support. And again, if it's delayed, I'm going to be looking at retained primitive reflexes. I'm going to look at structural issues. Are they having a problem with their pelvis, their sacrum, their hips, their knees, their feet? Is it uncomfortable to walk? Of course, we always want to check that. Are they having any weakness that they can't actually stand? And oftentimes, when I'm taking a history, I will find a history of developmental delay all throughout that first year, and also a large use of what I term contraptions. Pointing, 12 to 18 months. This is a huge one. And this one I ask of every patient coming in, especially if there is a potential that they might be having issues being on the spectrum or other developmental delays. Did your child point, or what age do they point? And this really should occur by 18 months. So this is getting the cooperation of, mom or dad or whoever's caring for them, that connection there. And it's linking items with words. So they're pointing because they want you to see what they're pointing at. And oftentimes a word might follow to give them that vocabulary. And they should also at this age comprehend about 50 words by 18 months. So that's quite a lot. But as I said, babies and children will understand way more than they can verbalize. So a red flag for autism if this does not occur by 18 months. Putting words together, 18 to 24 months, at least 2 words together. By 2.5 years, they should have some storytelling basics down, put a few phrases together. And by 3 to 4 years, they're able to tell more detailed stories. And if this is not occurring, we want to go back, of course, look at development, look at their primitive reflexes, make sure they're integrated, and check out the cranial nerves, which are, again, very related to what's going on in the upper neck and the cranial system. So that is what I do if language is not occurring. All right, imaginative play, 3 to 4 years of age. By this time, it should be all about, okay, you pretend that you're the, mommy and I'm the daddy and, we're going to do this and pretend like this thing is a phone. And, it's all about the imaginative play. Kids this age love the miniature versions of what adults do, right? They want to be in their little kitchen, or they want to play store. They even want to play school sometimes, right? So this is really helping with their social and emotional development. This is what this age is all about. It's not about flashcards and memorization. It's about how do we get along in the world? How do we negotiate our emotions? How do we, help people understand what we're trying to say? So sometimes kids will play out things that are bothering them. And kids on the spectrum are less likely to engage in this type of imaginative play that require make-believe. And this has to do more with, I think, the hemispheric imbalances that I talk about in my video on functional disconnection syndrome. So I will put a link to that as well as when I talk about hemispheres so that you can have a look at that if you're interested. All right, gross motor milestones. We're at the 4-year-old age. So we're getting up into the end of preschool, almost headed to the school age. And here we're seeing a real big jump in what's going on with the milestones. So I've broken it down. This is the gross motor aspects of milestones. So using the big muscles, they have more control. So when babies first start to walk, they're like little drunken sailors trying to work on balance and coordination and equilibrium. And then by 4 years old, they have more control. They can run faster without falling. They can alternate their feet on the stairs, jump over objects, do things like somersaults and skipping and trotting and that type of thing. Throwing and bouncing a ball, riding a bicycle. That's a huge one. If you want to do something really great for your child's brain, get them to ride a bicycle. And at 4 years old, they can do it without training wheels. Also climbing playground ladders and that type of thing. 4 years old, fine motor control. So this is the use of the small muscles of the body. And this is where they're going to be able to manipulate, maybe with minimal help, zippers and buttons and that type of thing. They can draw shapes when they're asked to write some letters, put puzzles together, scissors, string beads, pinch clay. So they can manipulate things a lot better using their fine motor control at this age. Cognitively, they're going to be able to sort by different aspects, put all the blue ones together or put the big ones here, the little ones here. They can differentiate that and compare and contrast. They know now at this age reality from fantasy. They can count at least to 20. They have clearer, logical, linear thinking, and will use words like if and when. And they can hold their task attention for much longer, at least 10 to 15 minutes, versus a younger child who might have difficulty doing that. Social and emotional milestones at 4. Again, this is, I think, one of the critical points of this age is that they are learning how to get along. They're learning to take turns and cooperate with others. Or maybe they're really bossy and they're a tattletale, and so they're learning by default that, maybe that might not work so well. They like to tell silly jokes. They also will try to get out of being in trouble by telling a lie. So they do know the difference between a lie and the truth, but they also know there's a consequence and they don't want to get into trouble. They also might push some buttons to see if they can get a reaction. This is where parents really need to be on the same page so they can't play you one against the other. This is where you can also not have to be there the whole time if they're playing with another child. And they can also start understanding more about physiology. Sometimes with younger kids, if you ask them to draw a person, they might just draw a face or a face with legs. So this is where they start to realize that people actually have bodies attached to them, and they will start drawing people with bodies. All right, now we're at the school age. So really things are ramping up. All the milestones at 4 years are just getting more refined, and they're able to do more things. They're having a better concept of time, because before the age of 5, it's sort of like, it's really difficult to say 3 days to a younger child. They don't know what that means. I used to say after 3 sleepies, and so, it was a little bit of a help because they can understand, okay, I sleep 3 times. They're having a little bit more autonomy with using the bathroom. They can, again, have more coordination and balance. Do more things that revolve around using the different sides of the body, so cross body. By age 6 to 7, they should be reading well, tying their shoes, and then reading a clock. So, I, being a chiropractor and also doing craniosacral work, it is one of those things that is really amazing for turning on really the power of the nervous system in the brain. So I feel really blessed that I get to do this, because every time I work on a person, and especially a child, I know that I'm helping their whole system release stress, create positive pathways, and really help them have this whole uh, this sense of well-being, right? That they are in control of their body. They understand what's going on inside their body so that they can adapt and respond to their environment around them, and do it on all of these levels. So trying to keep as balanced as possible. So yeah, love what I do. You can find me at losangeles-chiropractor.com. I've got all the credentials there. I can help with in-office and remote services, including things like milestone development, primitive reflexes, postural reflexes, other functional neurology evaluation. There is a program for interactive metronome, which has to do with the timing of the brain that can be done in your home, and I monitor remotely. And also bio and neurofeedback. Right now that has to be done in office, but who knows in the future, there might be something else going on. But thank you for joining me. Please like this if you found it to be helpful. Just click that thumbs up button. It really does help. It helps other people to see this information that they might not be aware of. And if you want to be notified when I come back on, just subscribe, hit that notification button, and please do share, because this information really needs to get out there. It's so important for our children, not only in our lives personally, but throughout the world. All right, have a great week, and I will see you next Tuesday at my usual time of 6:30 p.m. Pacific time. You can watch live or catch the replay. Thanks so much.